that declaration been made, federal funding would have been allocated.
So how do you tackle the problem? Joining us to discuss this, we have in New York, Maria McFarland Sanchez Moreno. She's the Executive Director at the Drug Policy Alliance. In New Jersey, Dr. Indra Sidambi. She's the Medical Director at the Center for Network Therapy. And right here in our studio, we have Josh Rushing. He's host of Al Jazeera's Fault Lines. And he and his producer, Layla Al-Alayan, just finished making the film Heroin's Children. It's good to have you here, everybody. Josh, let me show you this statistic and our audience as well. 650,000 opioid prescriptions on an average day in the US, according to the Department of Health and Human Services. You can't even get your head around that number. So what you did with the Fault Lines film was you actually said, how do we make this personal? How do we make this, people connect with what's really happening?
When we decided to do it, there's a ton of coverage on this, right? And in the States, at least, there's a lot of coverage. Outside of Trump, this may be the most covered issue. And it has been for a while. So we thought there's a lot of context out there. Rather than retread that, let's do something really intimate. And so what we wanted to do was to give you a film that when you watched it, you really felt like you were there and you were connected to these people and you got the very human side of the story. So we made a conscious choice to approach it in that very kind of intimate way and stayed away from a lot of the other context that's out there. Although all that stuff should be reported, we're just offering this kind of one very specific look at it.
Yeah, I want to show some people some pictures that you take, because you report and you take pictures as well. This is from your Instagram feed. Tell us what we're seeing as I click through this.
Yeah, sure. So we got called to a double overdose in Chillicothe, Ohio, small town, middle America. We go into this little house. There are two guys on the floor, feet to feet, completely out of it. And it's this interesting scenario where you're talking about a dozen cops and EMTs cram into the room. They're moving with the kind of like efficiency that you could only have if you've done something a million times. Right. Think about the way you make coffee in the morning without thinking about it. Right. They're moving like that, but at the same time, they're kind of a nerd to it because they've seen it so much. But for me, it was just heart-stopping. These guys, when you looked at the guys who had OD'd, they're giving them Narcan. They gave, I want to say, 5 hits of Narcan, and these guys weren't responding to it. Yeah. Their pulse is weakening. They're losing them. They're trying to save them. They got to carry them out of the room, and the entire thing is just shocking. But when you really stop and look at the guys who OD'd, and I have one photo that shows this, they're somewhere between bliss and death. They're like in the soundest sleep and not disturbed at all, even though there's all this action around them trying to save their lives. For most of that, we didn't show their faces in the doc. My photos, I only release photos where you can't identify them. But since I published this, since we came out with the story, one of those individuals found out he was in this doc, and he got back in touch with me, and so I now know his story.
Okay.
You know, your documentary is haunting. That's just one word to describe it when you see it and the scenes and seeing these faces and the kids and the effect on them. But I think one thing that our international audience, your film has an international audience, the show does as well, they're asking this question. This is Boma on Twitter, and he says, why is the opioid crisis a uniquely American experience, and why isn't it happening in other G20 countries? Maria, I'm going to direct this to you. I actually pulled up some stats here. This is via Vox. This came out earlier this year. Americans consume more opioids than any other country. This is standard daily opioid dose for every 1 million people, and you can see the United States rates right there. Maria, is this a uniquely American problem, and why is that?
Well, the opioid overdose crisis has definitely hit the U.S. much harder than any other country. And some of that may have to do with prescription practices and broader issues. But I also think that a factor we have to bear in mind is that the war on drugs in the U.S. has been so aggressive, and the lack of public education about drug use, about the risks of drugs, has been so serious and widespread that right now you have a problem where a lot of people who use drugs do so underground and do so in a way where they don't know necessarily that if you combine opioids with alcohol or with benzodiazepam, that that's going to increase your risk of overdose dramatically. and where they have no ability to get their drugs checked to see if they are contaminated with fentanyl, which again makes overdose much more likely. So these are situations where people are going underground, they don't have access to information, they don't have access to experts and help, and they don't have access to treatment because evidence-based treatment is actually very, very hard to get in the United States. Medically assisted treatment in particular is very hard to get in the US. So people are adrift and dying.
Dr. Indra, I just want to share this with you. This came from Jen Beijing. She is a former member of the Stream, but also now a substance abuse prevention specialist. And Jen suggests we need to educate the public with PSAs to help in an OD situation, overdose situation, because that's the reality now. We're way beyond preventing overdoses. Do you think the general public has enough information of what it means to be in an opioid crisis right now in the States? Do they know? Do they understand what drugs can do?
Unfortunately, they really don't know. It's not surprising to me because every single day when a parent of a patient of mine walks in through the door, they have no clue about what this opioid use means and what does this overdose really mean. So I don't think people are well educated about this opioid crisis, even though we are in the midst of this crisis.
Well, I mean, I
Josh,
was
go
just
ahead.
taking on, I think a lot of people think that Narcan's the answer there, and they're making that more readily available. But the problem is, in my experience, is that it's not working anymore. And it's not working because so much heroin on the streets is laced with fentanyl and carfentanil, and the Narcan doesn't really, those don't respond to it in the same way. So I watched these guys get 5 doses of Narcan, and it didn't bring them back.
And let's just explain just very quickly, Narcan is a drug that can be administered in different ways. It's sometimes in a syringe that gets put up your nose. It blocks the effect of the opioid, so helps people who are overdosing come out of that overdose. Maria, what were you going to say? Please go ahead.
Oh, I was just going to say that putting naloxone in the hands of first responders is a positive step, and it's one of the things that Trump mentioned. But precisely for that reason, that fentanyl is so often in the supply now, it's really important to get naloxone in the hands of people who use drugs, their friends, their family members, because fentanyl works so quickly that you really need the overdose reversal medication much more quickly as well if you have any hope of making it work.
And Dr. Indra just told us how ignorant the American public is about drugs. So fentanyl, in a sentence, is?
Fentanyl is 100 times more potent than heroin. So it is a synthetic opiate. And also I'll tell you, to piggyback on that, naloxone not reviving patients is because of also polysubstance use, mostly benzodiazepines being used by these people who are using heroin. So reviving those kind of polysubstances is not possible. Just naloxone is not a panacea. You know, giving naloxone to both family members and to the person who's being given opiate prescription is not the solution, because overdose is not a planned one. It's an accidental event. So when they overdose, even if they have naloxone, then they cannot be using that. And most times these people who are overdosing are alone in their home environment. So they are not doing it in front of their family members. So I would think the first responders having naloxone on them and reaching people is quite meaningful.
So we've just scratched over the surface of this opioid crisis issue in the United States. But last week, the President of the United States declared this situation a national health emergency. Let me just remind you what he said. Have a listen to this.
This epidemic is a national health emergency. Unlike many of us, we've seen, and what we've seen in our lifetimes, nobody has seen anything like what's going on now. As Americans, we cannot allow this to continue. It is time to liberate our communities from this scourge of drug addiction. Never been this way. We can be the generation that ends the opioid epidemic. We can do it.
we can do it. Well, here's what people online felt about that. This is Ken on Twitter. He says, seriously, Trump declaring an opioid crisis an emergency makes just $57,000 available. He goes on to say $57,000 would cover tuition for one counselor. Is that enough to fix it all? It won't buy much airtime for really, really good advertisement on it, especially picking up on the fact that someone earlier said we need more PSAs on this. But Indra, Anthony here feels a little bit differently. He says it's good that this is being treated as a health issue and not a war. What do you make of the announcement?
I really think the funding is a huge problem now. We don't have enough funds, and even the funds that are available right now, I question, are we going to spend it in the right direction? See, everything that the president brought to the table is in the right direction, but what are we going to do for the funds, number one? Number two, how are we going to support this opioid epidemic? Is it going to be more beds available inpatient, or embracing the newer modalities like outpatient detoxification, which is quite successful and half the cost of inpatient treatment? So that way we can make available, the funds made available to treat more people who are suffering from this disease.
Maria, there's a tweet that you shared a couple of days ago. Here's what Donald Trump should have said about opioids instead. You kind of retooled what he should have said to the nation. Give us a little snippet of what the most important thing that should come in terms of leadership in the United States right now regarding this opioid issue.
I think you have to recognize that a big part of the problem here has been the war on drugs. The U.S. has been the main U.S. response to drug use and the drug trade over the last 50 years has been to criminalize. And Trump, in his speech, even though he mentioned public health and he did talk about increasing access to naloxone and a couple of other measures that might be helpful, overwhelmingly he repeated the same lines of the past. He talked about prevention strategies and ad campaigns that were all about just saying no, which is the same campaign that Nancy Reagan pushed in the 1980s and which failed. He talked about using drug courts, which are again a criminal justice tool, criminalizing a medical issue. He talked about enforcing criminal laws, and he talked about building a wall on the border, even though the fact is most immigrants are more law-abiding than U.S. citizens, and even though organized crime across the world has always found ways around every wall, every border that the U.S. has put up to stop the drug supply. So my bottom line message is we need to have a new approach. You cannot keep doing the same thing over and over again and expect a different result. The war on drugs has led us to this place where the U.S. does have this dramatic increase in opioid overdose. Let's think about some new alternatives. Let's think about ways to acknowledge that, you know what, some people are going to use drugs. Let's teach them how to avoid the harms that sometimes go with drug misuse. Let's teach them to avoid mixing opioids with alcohol or benzodiazepam, which makes them more likely to die. Let's treat kids with respect and give them meaningful education about drugs. Let's offer good treatment, evidence-based treatment, medication-assisted treatment to those who need it. Let's reduce harms by offering supervised consumption sites for people who do use drugs so that at least they're using drugs with clean needles and aren't exposed to infection, and so that at least somebody is watching them while they're consuming to prevent the risk of overdose. So there are a lot of measures that one could adopt, that other countries have adopted, that some cities even in the U.S. have been exploring, and increasingly states want to explore, but that weren't part of Trump's speech, and so that I view as a huge problem.
And you know, Maria, even as we look at new alternatives, though, there are people online who want us to remember one thing. This is Allison. She says, generally, addiction was viewed as a moral failing or a choice, not a medical condition warranting science-based treatment. That's slowly changing, but why it's slowly changing, people have some theories. Josh, I'll show you this tweet, and we got a lot of other ones just like this from Dorian, who says, look at the incarceration rates for blacks on drugs versus whites. White people need help and blacks get thrown in jail. And he references in other tweets the crack epidemic from the 80s here in the US. Do you see a disparity there? Do you see a difference?
Yeah, I think he's spot on. I think the criminalization of it, and I think the media narrative, the way they treated the crack epidemic in the 80s and the way we treat this now, and I do believe that race is a big part of it, of who the victims are. I don't think that the answer now is to cover this story the way we wrongly covered that one. I mean, I wish we could go back and cover that one in a different way, but I certainly believe that race has played a part in this kind of narrative changing.
Let me share with you what's going on the website whitehouse.gov as we're doing this show. It's a meeting of the President's Commission on Combating Drug Addiction and the Opioid Crisis. So just listen in for a couple of seconds.
And I think it gives us a blueprint if we stay the course and persevere and recognize that we are dealing with a brutal beast who will stop at nothing on its own to be successful. And we need to follow through and be as aggressive as addiction is. And that, for us, I think, in many respects, will be our greatest challenge. We need to stay with this issue.
Dr. Indra, this is a White House commission. It's hopefully informing the president and the current administration in better ways to tackle the opioid crisis. Is even just seeing meetings like that, is that a step in the right direction? Attitudes beginning to change, perhaps, Doctor?
I think as a president, he can only address this thing from top view. But I think as a treater, being an addiction psychiatrist, I look at this very differently. Decriminalizing, which Maria did talk about, decriminalizing the drug charges is important than decriminalizing the drugs in itself. What do I mean by that is when a person actively uses drugs, they incur charges. And when they meaningfully engage in treatment and complete the treatment, these charges that they incurred while they were using come back to bite them. And so they are not able to go back into workforce, and that becomes a trigger for them to relapse. So I would think it's important to really address decriminalizing of the drug charges. That helps us in two different ways. One, it pushes people who are using to go back into workforce, so that avoids future relapses. And secondly, the $200 billion have been spent on criminal justice system. And if we even release like 25% of that money, that can be directed to the treatment, and that will be meaningful at this point in time. I think all these factors are very important. The funding. This is the main point in going ahead with all these beautiful ideas that we have on the table.
So I hear what you're saying there. I want to bring in this comment via YouTube Live. Yana is watching this show and says, the only way to stop the opioid crisis is to heavily reform the pharmaceutical industries and the corporatization of healthcare. And no one knows that better, Josh, than someone who sent us a video comment. This is Maureen. She's the head of an advocacy group, and her son is a recovering addict. And this is what she told the stream. Have a listen.
I became involved when my son became addicted to legally prescribed controlled narcotics, painkillers. That happened in Florida, and that happened during the time when the Florida medical boards apparently felt that prescribing 300 Oxycontin, 200 Soma, and add some Xanax in there was an acceptable medical standard of care. This went on for over 3 years of grossly negligent prescribing. Thus, we have folks that have become addicted all up the east coast of the border, because of the OxyContin Express. This is a man-made epidemic, and it is controlled by the physician community.
So Josh, she says this is a man-made epidemic. Right. Does that ring true from the reporting you did?
Yeah, I absolutely think so. And in fact, it's one thing to talk about the criminalization of it and how it's created this problem, but that also dovetails with a movement in the medical industry to treat pain. Came around in the 90s that the patient had a right to say they were in pain and that a doctor should treat it. That came around at the same time as it's kind of like Yelp and these type of programs where you would review doctors. So if doctors didn't treat pain, they might start to lose business and start to lose customers. This also converges at the same time that the companies who create these pills are incentivizing the doctors on the back end and also advertising for these pills, which is unusual in America that you can advertise for a prescription pill as compared to other countries. So this is really driven from the corporate side and the corporatization of the American medical industry, like that person said. I think they're spot on. I talked to so many people. I talked to one dad, his son played Division I college football, really top tier athlete. 12 kids on his football team, which was Akron University, ended up in rehab from opioids. Wow. 2 of them, including his son, ended up dead. And his son's addiction started with 60 Vicodin pills that were prescribed by the doctor. There's another thing that happens in the U.S. is the way we accept authority. And we think that doctors are authorities and that they have our best interest in mind. So if they give your son 60 Vicodin and say he needs this after the surgery, we do it. Meanwhile, the companies that made those pills were telling the doctors they're not addictive, don't worry about it. And all of this kind of converges together into a perfect storm of what we're seeing now.
So, Dr. Indra, I started this conversation with a look at how many thousands of opioid prescriptions were dispensed every day to people around the United States. So I'm wondering, is the pressure now coming back on the doctors and the medical professionals who are writing these prescriptions to say, hold on a minute, maybe we help to start this opioid crisis, can we help to end it?
Beautiful question, and this is how I look at it. The opiate crisis started in the beginning, in the turn of this century. The Veterans Administration and the accreditation body pushed doctors to make pain as a 5th vital sign, and therefore 80% of the patients identified themselves with some sort of pain, and that led to this unthoughtful process of writing pain pills, and here we are in the midst of opiate crisis. And let's look at the prescription written for pain pills in the past couple of years. I would say 65% of these opiate pain pills were prescribed not by the specialist, not by the pain doctors, but by the nurse practitioners and the family physicians. And if we can educate these people not to write, pain medication for every person who walks in, through the door with some kind of pain, then that in itself will control this. The good solution that I'll bring to the table is that limit these prescription pain pills to the specialists who are treating the underlying pain. Say, for example, if someone broke their ankle, then the person who is treating that will be an orthopedist, and that person should be the one who should also be controlling the pain prescription that goes to that patient. That way they know when to start, when to end, and how long to keep them on the pain medication. And if there were to be any concern about the person getting addicted to it, they should be referred to an addiction psychiatrist to work hand in hand with the orthopedist, and so on with other pain entities too. If it is a back pain, then we are working with the pain management person and with the addiction psychiatrist on board. I think that will be a better direction to take.
Thank you, Dr. Indra. Thank you, Maria, as well. And thank you, Josh, for being part of this program. Malika, where do you want to leave us?
With this from Dr. C. Thomas on Twitter, who says, we need all-encompassing continuum of care. The entire system needs to be reformed, and how we approach this epidemic needs reform as well.
And for more on the Fault Lines documentary, Heroin's Children, you need to go to aljazeera.com/faultlines. Thank you, guests, for being with us. Thank you for watching. See you online.